quite frankly, as a woman, as a person who decided to have kids, as a Black woman in the US, where it is like, my risk of getting sick and dying is much higher as an OBGYN who's delivered women and people who get very sick from pregnancy, who die. Like, I think I take it very seriously, whether or not you feel like it's the right thing for you.
I'm Keltie McGuire, and you're listening to the Kids Are Childfree podcast. Hello, and welcome to the Kids Are Childfree podcast. All right, as will probably surprise no one of the big questions that comes up alongside this question of kids or child-free is, can I even have kids or be child-free? Namely, am I able to? Is the timing right? How is my fertility? And while I would love to give you all counsel in terms of how exactly to explore this big fertility question, alas, I am not the expert for that. However, it is certainly something that you want to be thinking about and considering if you are not already, especially for those of you who are, if anything like me, probably approaching an age at which we are being at least told that our fertility is really at risk and that having kids may or may not even be an option. So today I went straight to one of the experts on this topic of fertility, and I am so excited to share our conversation with you. Today, I'm speaking with Dr. Amanda Adeleye, a reproductive endocrinologist and infertility specialist. She provides fertility services, including IUI, IVF, and fertility preservation at the newly opened fertility clinic, CCRM Chicago, where she is the founding partner and medical director. Dr. Adeleye received her medical degree from Columbia University, completed her residency at New York Presbyterian Columbia University, and did her fellowship at the University of California, San Francisco. Dr. Adeleye is committed to improving the educational resources available to all patients to inform them on their fertility journey. As part of this work, she helped to create Roon, a free, trusted health platform founded by doctors to replace unreliable internet searches with expert medical guidance. Well, I don't know about you, but there is a lot of unreliable internet information out there. So let us set some facts straight, or let's say separate fact from fiction. And please, without further ado, here's Amanda. All right. Well, thank you so much, Amanda, Dr. Amanda Adeleye, for joining me today for this conversation. And as I was telling you before we started recording, I feel like this conversation, specifically around fertility, and we're going to be hearing about this cool platform that you've partnered with, which will hopefully be a great resource. I know it'll be a great resource for our listeners. This is something that there is so much both misinformation and I think a real lack of understanding around for a lot of folks. And so I'm hoping that you can enlighten us today to a certain extent with the amount of time we have. And so welcome to the show. And why don't, to kick things off, you just tell us a little bit about yourself?
Yeah, first, thank you so much for having me. What a cool program you have and podcast. I'm thrilled that there's kind of a really serious conversation happening around such big decisions in like a very organized and thoughtful way. So just kudos to you for that. So I am a reproductive endocrinologist and infertility specialist. So REI for short. That means I am an OBGYN by training, and then I subspecialize with an additional 3 years of training specifically in understanding the hormones and physiology that help us to reproduce. And so kind of the bread and butter of what I do is fertility care, the majority being treatments for infertility, like intrauterine insemination or IVF, but also egg freezing, and also fertility care for gender diverse folks as well. So that's what I do. I'm from Illinois. I went to medical school at Columbia, stayed there for residency because that is where I met my husband, and then did a fellowship out at University of California in San Francisco, and then came back and I was faculty at the University of Chicago for about 5 years as a reproductive endocrinologist before starting my own practice, which is CCRM Fertility of Chicago. So I'm the medical director, so I'm always here early in the morning and very excited about what I do.
Wow. I have to say, I had this conversation with my husband the other day. So I'm 43 and I said to him, I talk to people in their like late 30s, early 40s. I'm speculating here. I don't know how old you are, but I'm just amazed with the amount of experience and like the accomplishments and wow, like you've already, it sounds like had such an interesting, in-depth career. And very cool to see what comes next for you. And I'm so glad to have you here, because I know for me, like, I open up my Instagram feed and the amount of information I see about, like, well, your hormones are doing this because of that. And if your fertility's, there's just a lot of stuff there that I'm excited to hopefully delve into with you today. So, okay, now actually the reason I became acquainted with you through this good fortune is because somebody had reached out to me from a company, an organization that you've partnered with called Roon. And I was quite intrigued to hear what Roon is up to and to learn more both about yourself. And so you could come speak to our audience about all things fertility and hormones and whatnot. Can you tell us a little bit about Roon in terms of like why you've partnered with them and actually what they are and what they do?
Yeah, so Roon is a medical platform for patients and support people experiencing different health conditions. And it's a resource where you can learn from experts in the field across a number of different specialties. So both medical experts, people with lived experiences, therapists, really a holistic approach to ultimately answering the question like, okay, I've got this condition, like, what do I do? What should I expect? And of course, it's not medical advice personalized to you, but there's a tremendous number of questions that are answered and likely might kind of sync up with the question that you've had. And it's all video clips, which is so nice. And to me, it kind of feels like an evidence-based version of TikTok, and really directed at giving you the answers that you're looking for and not kind of pushing you down a rabbit hole.
Yeah, I have to say, I feel like, so I went on there and I was curious, like, what sort of topics were on there, because initially I thought, oh, maybe it's just fertility related. And having chosen not to have kids, I felt like, okay, maybe the information there is not for me. But there was stuff on there about endometriosis, which I personally, I hate to use the term suffer from, but I certainly have in the past. There was information about like urinary tract infections, like stuff about dementia. And I have to say, as somebody who, like, I have a tendency, perhaps listeners can relate, to be a little bit the Dr. Google. I know you physicians probably hate folks like me, but it's hard to know what resources online are reliable. And so I'm curious, like, again, I know you're not one of the founders of the company, but having partnered with them in your involvement, was that the motivation, or why did they, or Roon, decide to start this?
Yeah, I mean, the one of the founders, unfortunately, his father had a neurologic condition, which, affected him. And one of the co-founders is a neurosurgeon. And so even as a surgeon, felt like, gosh, there was really a paucity of good quality information about essentially the experience with that medical condition, and that inspired him to start Roon. So again, I really think it's cool that it's a more holistic approach to it, and not, it's not just, going to, X website that maybe is medically appropriate, but kind of just like a website, reading off to you exactly, the most basic questions about a condition. But like, gosh, like, what does it feel like 5 years down the line? Or, if I have endometriosis, is that going to affect X, Y, and Z for me? So I think it takes a slightly different approach in that regard. And I mean, there's thousands of questions for a given condition, which I think is just amazing.
Yeah, no, it's super cool. And for people listening, like, I think you might have mentioned this, but this is a free platform. So we're not here. I'm not trying to sell you a subscription to Roon today. It's just something that you can check out. And you, interestingly, some people might remember Leslie Schrock, who wrote a book called Fertility Rules. She was, I think, guest number 3 or 4 of the podcast. And you're going to be like guest 70 something. And she's one of the people who's on this platform. And I know there are a lot of like really incredible, well-recognized professionals, experts, of course, doctors. So yeah, I was curious to speak with you. And I think, again, this perspective of there is, at least it seems to me where I stand, such a lack of information around, and I want to speak, of course, with the Kids or Child-Free decision, to our reproductive health and fertility. And I have a lot of clients who say things to me like, I'm 36 years old. I'm trying to decide if I want kids and I don't even know if I can have kids. And I'm like, well, potentially there's a starting point there it's not going to be my involvement, but like, is there some information you can get? But I think what a lot of people feel is, I don't even know where to go. I don't even know what to start. Maybe they've had their physician say things to them like, hey, the clock is ticking. You should be thinking about this. Are you planning to have kids? But would you agree there is a gap in information and also misinformation and out there? And like, what would you say are some of the most common reasons for that you see?
100%, I agree that there is such a paucity of knowledge and conversation about the topic. It's interesting, even within the American College of Obstetricians and Gynecologists, the guiding body for general OBGYNs, like there is an emphasis to ask patients every year, like, hey, like, are you planning to have a kid this year? But really, right now with the spin up, okay, if you're not, well, what kind of contraception are you going to be on? How can we help you prevent having kids? But what I'd love to see is really an expansion of, okay, like, are you thinking about having kids in the next year? If so, here are things that we can do to help you. Now, that said, if you are proactive with your OBGYN and say, hey, I'd like to have kids in the next year, they typically will have, a set of things for you to do and to discuss with you. But it really takes the onus on the patient to be proactive about asking. And I think that that's a bit unfortunate. And I mean, there's a variety of OBGYNs out there. There are fantastic ones out there that really are making this a conversation. But I mean, the reality is a lot of people don't go to the doctor regularly and certainly don't go to their OBGYN regularly. So if you're already missing kind of the very first step, like who's going to teach you or talk to you about your fertility. And I also think that in the US, at least, we're awful about talking about sex education and fertility and family building to adolescents. And I mean, that's really the time to do it. It's about learning about your body and biology. And it's not scary or bad or immoral. It is simply like, we are humans and this is how we reproduce. And the knowledge is the power for you to decide and advocate for yourself when you want kids or when you don't want kids and what to think about. But I think that as adults, we're generally woefully unprepared in terms of like even understanding like how babies are made. Like I start every consult with essentially that, regardless of, my patient's educational background. Like we're going to talk about anatomy and we're going to talk about like just kind of the facts of life.
Yeah, absolutely. And, it's funny, there's, I can't remember their names, but there's like a British couple, in the UK who they recently announced that they're pregnant and they talk a lot about their relationship and, this kind of process and being expectant parents. And one thing that I think at least he, maybe not she, was aware of, but like the fact that there's only 1 week or few, really 2-3 days in, I was going to say the year, in the month, in a woman's cycle where you're actually able to get pregnant. And like, I see and hear these types of things so often that people say, I really didn't know. Or I think there's also this idea, you probably hear and see this a lot, like for so long, especially, I think especially as women, it's like trying not to get pregnant. And then it's the assumption that it's going to be so easy, right? We have so much fear instilled in us about accidental pregnancies, probably rightfully so to an extent, right? Especially when we're young. But then when it comes time to actually, if you want to have a child, trying to conceive, as I'm sure you see and hear, it's not just snap the fingers and there we have a baby.
Mm-hmm. Absolutely.
Yeah.
Absolutely.
Okay. Well, I love that you're having these conversations with your patients, and it sounds like in a way that's respectful. And I mean, it should go without saying that you're respectful, but I have to say myself, like as someone who, when I had my endometriosis diagnosis, I can't tell you the number of times that I had the OBGYN that I was seeing at the time. Or she might have just been a gynecologist, actually. Is that a different specialty if somebody has obstetrics, it's like coupled on top of or in addition to, or are gynecologists always obstetric physicians as well? Or does it depend on the country?
Yeah, no, amazing question. Amazing question. Yeah, no. So
okay, good. I wasn't planning to ask that, but
yeah. No, but it's great. I love talking about this. So yeah, at least in the United States, the specialties obstetrics and gynecology. So anybody that you see that's board certified has experience delivering babies and managing gynecologic conditions, both surgically and in the office. But once they're kind of done with training, some folks love to do it all. Some folks will just do, office gynecology, pap smears, bacterial vaginosis, things like that. Some
Yeah.
are just, focus on surgery, and some do the breadth of it. And then there's some nerds like me who just kind of keep going and training and get very esoteric on a specific condition.
Yeah. Okay. Yeah. That's okay. That helps. So in any case, this gynecologist, maybe I'm in Germany. I don't know. I assume she must have trained, and I don't know if she practices obstetrics. I don't think so. I mean, you would think that there might be a note in my file, but it was said again and again, well, you should consider getting pregnant, but not just because potential threats to my fertility, but it was framed as this is a way to help treat and manage endometriosis, which I'm curious because I know we have people who struggle and suffer with endometriosis and the like. And like, I've heard that that's a myth and that's basically bad medicine too. And I'm going to just ask you the question, like, what are your thoughts on the idea that becoming pregnant is a treatment for a condition like endometriosis?
I certainly would not recommend a life-altering, potentially life-threatening condition like pregnancy to treat endometriosis. Like, I would not consider it a treatment. I have heard anecdotally, and I'm not really up to date on the literature on this, that sometimes progression of endometriosis may be slowed in pregnancy, but honestly, I'm not sure why. I mean, endometriosis to some extent is we think at least a little bit of an immunologic condition. And pregnancy is a time where you're kind of immunosuppressed because there's something in you that isn't totally you. And so you don't want to attack that. So I don't know if that might play a role. But I certainly for my time, when I used to deliver babies, like I don't recall patients with endometriosis, getting to the end of pregnancy, having like raging problems. I think it probably is. It might be coerced a little bit, but I definitely, I'm not up to date on the literature in that specific condition. So don't take that home, but I would never recommend it as a treatment for endometriosis. I will say she was probably towards the end of her time as a physician, as far as practicing, I want to maybe say it was a bit of an old school attitude, but it felt really harmful for me for a few reasons. One is I expressed my wishes that I would not like to have a child. And second of all, to your point, like this is whether or not, let's say that pregnancy can magically eradicate endometriosis, which, we know it can't, but let's just say it could. The idea, like you say, that we would bring a whole human into this world for that reason. Anyways, I've gone on a tangent. That was actually a secret sort of like vibe check just to make sure that we're on the same page here today and that I can trust you to share some good counsel with our listeners. So, and I always like to relay my fun medical experiences. Who doesn't like to hear about that? Okay. So I want to, on this, going back to this topic of, or kind of, I guess, staying on the topic of misinformation and confusion around fertility. One thing I hear from a lot of people is like, I'm almost 35 or I'm now 35 or I just turned 35. 35 seems to be this magic number. And for point of reference, like I would say most of the clients I work with, most of the people listening to this podcast are probably going to be like early 30s up to early 40s. And of course, they are well aware that there is a time constraint for them, especially when it comes to like conceiving and having a child naturally. So what do we need to know about our age and fertility? Like, can you give us a couple of actual concrete facts about what happens at 35 or any other age? Yes. Okay. So I'm going to try to keep this to 2 minutes, but please, like if I'm rambling, please stop me. But okay. So there's kind of two things to think about when it comes to what we'll call ovarian aging. One's going to be egg quantity and the other one's going to be egg quality. So in terms of egg quantity, humans with ovaries are going to be born with all of the eggs they're going to have. It's about 1 to 2 million eggs. And then there's going to be a pretty consistent loss of those eggs, like even before you're born and then throughout childhood and into your reproductive years. And so by the time somebody hits puberty, they typically have around maybe 500,000 eggs left, somewhere around there. And then there's going to be this kind of consistent loss of immature eggs and then also a cyclical loss of eggs that have kind of started to mature in a menstrual cycle. Ultimately, there is an increase in the loss of eggs as we get towards like age 37, 38, perhaps by, mathematical modeling, we think that happens. And by the time you get to be about 51, most people have around about 1,000 eggs left. And the issue then becomes, no matter how hard your brain works to stimulate your ovaries to release an egg, that's, essentially what happens in a menstrual cycle, there's just not enough of a signal to really trigger that egg to be released anymore. And so we call that menopause. You don't ovulate anymore. That's menopause. Egg quantity, especially in America. I mean, in Germany, maybe it's different, but we've got this whole silly thing about bigger is better, more is better. Egg quantity in and of itself does not predict your fertility, but it is associated with, if you need fertility treatments, the more eggs you have, then honestly, the better for the most part. But from month to month, if you're not in treatment, egg quantity does not matter when you're actually trying to get pregnant. The other thing is egg quantity. If you are thinking about fertility, it's just not the ultimate predictor of whether or not you're going to be successful, unless you're totally out of eggs, which it's very atypical for you to be out of eggs before age 40. So then what does matter is egg quality. And when I say quality, I'm talking about the chromosomal quality of the eggs. So chromosomes, taking us back to high school biology, if we were even fortunate enough to get that information, is, chromosomes are the long strands of DNA. They tell your cells what to do. All the cells in our body should have 46 chromosomes, except mature sperm have 23 chromosomes and a mature egg has 23 chromosomes, such that when the sperm and the egg come together, the new embryo is going to have 46 chromosomes. The silly thing about humans is that our eggs that we're born with actually have 46 chromosomes. And it's only at the time of ovulation that the egg that gets released actually divides the chromosomes evenly within the egg cell. And the egg cell actually divides in two. So you're only kind of spitting out half of the original egg with those 23 chromosomes. As we get older, particularly starting around age 35, the mechanical process of separating those chromosomes starts to break down. So sometimes you're going to ovulate an egg that'll have 22 chromosomes or 24 or 25. If it's anything but 23 chromosomes, when that egg is fertilized, that embryo is going to also be chromosomally abnormal. And typically chromosomally abnormal embryos don't implant or grow, or if they do, the majority of the time they'll lead to a miscarriage because there's not the right kind of quantity of genetic information. So that process, it starts in your 30s. It's not exactly at 35. Okay. It's probably different for everybody. But when you look at large data sets in general, starting at age 35, you do see an uptick in the proportion of embryos that people make that are chromosomally abnormal. And that rate of change, it's about maybe 5% per year. But to level set, in your late 20s, early 30s, the majority of embryos you make are going to be normal, about 70%. Will be chromosomally normal. And by the time you get to 40, about 40% of the embryos you make will be chromosomally normal. By the time you get to, say, 44, 45 and above, about 5% or less of the embryos you make are chromosomally normal. So really you can, without being able to kind of show you a picture, there is some change in the 30s, but it's really mid 30s and beyond that there is kind of this linear progression of more abnormal eggs being released. And that's something that we don't currently have technology to fight against to, address that issue when you get into your late 30s and 40s, unless you want to freeze your eggs or embryos.
Okay. So much information there. And I have to say, I want to say the majority of that I actually did not know. And I consider myself to be relatively well versed about my human biology and reproductive system. I had heard about egg quality. I don't want to say, of course, perhaps people haven't, but I also was really of the impression, when you say, I'm guessing 51 is the average age of menopause. Is that why that was a point of reference?
Correct.
Okay.
Yeah. In the US, but globally it really hovers around 50, 51. Yeah.
Okay. But the fact that we enter menopause, and it sounds like a lot of people with ovaries still have some, you said 1,000 eggs potentially, which I think a lot of us, at least the language we kind of use and how we talk about is I'm running out of eggs. There's still eggs. It's that the quality, not for everyone, but it sounds like the majority of people, but the quality isn't there. Is that correct?
Correct. The quality is not there. And really, it's so important for the brain and the ovary to work together. And as the egg quantity goes down, the brain is not able to kind of overcome and send the right signal anymore to the ovaries. And so at some point, the ovary is just forget it. I can't do this anymore.
Okay. And so I'd heard it framed this way, and what I'm hearing is the same, but I just want to confirm it. Yes, there is a shift around age 35 or in the mid-late 30s, but somebody described it. It's not so much as a cliff that drops off, but it's more like a slide or a decline. It's more gradual than immediate. Does that sound like a good way of describing it?
Correct. Yep. It's definitely not a cliff. And so like, it's sort of frustrating. I think to your point earlier, like, it's almost like it's bimodal in the media. Either there's like
Yeah.
no conversation about ovarian aging and infertility, or it's like this very alarmist sort of conversation. And like, you're 35 and your life is over. Like, I definitely have patients that come to me and they're like, I'm 35. So like, I've got to get pregnant now. And I'm like, no, you don't. Like, let's talk about what the biology is. So you're absolutely right. It's not a cliff. It is more gradual, but it's still, I think if family building is important to you, then it's important to truly like level set about, what your goals are and realistically when you'd want to try, because it does get harder. So I don't want to dismiss that, but it's not, everything falls apart at 35.
Yeah. And so, I mean, what would you say that balance is? If we have someone, let's say, who's 35, 36, and they're like, I'm still trying to figure this out. I don't know if I actually want kids or not. And they're like, I have people come to me and they're like, I got to decide by September or like whatever. They have this, it's often not an arbitrary date. It often pertains to a birthday or like an anniversary or something like that. Like I think you sort of gave me your answer, but what would you say to someone who's saying, yeah, my partner and I are trying to figure out if we even want children. I'm 36 years old, let's say. What would you say to them in terms of like how much it should be like brake versus gas on proceeding with that?
Mm-hmm. So what I do with my patients is it's a really goal-oriented conversation. Like if they're not trying to get pregnant right now, it's always very goal-oriented. So the questions I always ask, like, how important is it to you to be a parent? Is it like the most important thing in the whole wide world? You cannot imagine not being a parent. Is it like a nice to have? Like, yeah, you imagined it, but like if it didn't work out, like, that would suck, but you'd be okay. Is it like you're kind of ambivalent? Like, you could go either way. You don't really care. And then there's some people who are like, I don't think I want to be a parent. I'm only seeing you because it's like an insurance policy, right? So I always ask, like, well, where do you fall on that spectrum? And the next thing I say, it's a little bit shocking, but it's really just to kind of drive home the point. Like, if being a parent is like the most important thing to you, like you should be trying to get pregnant now, because there's nothing I'm going to offer you that's going to guarantee your fertility. And I don't know if you can, have a family or not, genetically speaking, right? There's so many ways to build a family. And we also talk about that, but like, I can't guarantee it. So if it's like absolutely the most important thing to you, then you should try now. But most people are not really in that position. And I'm not advocating you to kind of blow up your life and try to get pregnant. But just more to drive home that like, there is going to be this ambiguity. And like, I can't answer for patients, like, where are you in your life? And like, how comfortable are you with that? Like, are you the kind of person who, like, if you get to your 50s and you feel regretful, like it's going to eat at you for the rest of your life? Well, if that's the case, then maybe we should be having more of a conversation. If you are the kind of person who's like, nope, I made a decision and that's it, and you can move on, then great, right? Like I think although I'm a physician and I'm here to give the medical facts, I do enjoy like trying to kind of guide people. It's like, it's goal oriented. It's like, what do you want to do? Right. I can provide you the medical techniques if you need them, but ultimately I'm not going to tell you what to do. It's really like what matters the most to you. Yeah. And then I ask a couple questions about like, do you want to be a single parent by choice if things are not working out, if you're coming to me and you're single, or like, do you have to co-parent with somebody? If so, is there somebody there that you want? Like, we'll ask some of those like follow-up questions as well.
Wow. I'm so impressed. Like, I feel like this, I mean, I hear about the US, I'm Canadian, by the way. So, I mean, I have some point of reference to North America, but our medical system is quite different, has its own share of issues. But having lived in a few countries now, like this is such a refreshing, consultative, human-centered approach to care. And it's all too uncommon. Like, I mean, so, I guess because it's a privatized system, like, is it because you're able to take more time with people to be able to delve into this more? Because this, to me, this should be standard for the way all of our practitioners are working with us.
Yeah, I totally agree. And I want to say, number one, like, I know I'm not the only one who's like this. There's like there are there's lots of great, fantastic REIs out there who do touch on this. But I mean, some of it probably, economically speaking, has to do with like the medical system and how it's set up and whether you counsel. But I also just feel like, quite frankly, as a woman, as a person who decided to have kids, as a Black woman in the US, where it is like, my risk of getting sick and dying is much higher as an OBGYN who's delivered women and people who get very sick from pregnancy, who die. Like, I think I take it very seriously, whether or not you feel like it's the right thing for you. And sort of like going back to what you said earlier with your old OBGYN being like, you should have a kid. Like, that's wild to me. It's like,
yeah, me too.
Pregnancy is
I
like
changed doctors, by the way.
Okay, go
in case that wasn't clear from my story. I was like, we're out of here. Like, I don't know how many times I have to tell you this, but it felt very disrespectful.
Yeah. It's like, I think, especially in the US, like, I don't know what it's like in Germany or in Canada, but there's like this very odd, like, kind of whitewashing or kind of Disneyifying of, pregnancy and parenthood. And I really want to emphasize parenthood, that like, it's great, you should do it. It's like people die getting pregnant, being pregnant. People's lives are like ultimately changed. Like economically, it can be really tremendously negatively impactful. Like, and forget like that's with, forget what if you have like any underlying like mental health issues, right? Like these things can like dramatically change your life. So I just think we have to be, respectful and considerate of like, there's so many things that go into deciding whether or not to be a parent. And I'm speaking to the choir. Like, obviously this is like your bread and butter.
Yeah.
But I think helping people, I think that people don't really get the time to sit down and think about that generally, right? Like if you happen to bob your way into an OBGYN's office, like the chances that you've been deeply thinking about this are low. But before I'm going to like offer a medical treatment to you and put you under anesthesia and all this stuff, it's like, I want to make sure like this is actually what you want, right?
Yeah. Wow. I love hearing that. That is so refreshing. Okay. I know our listeners are just going to love you. I'm sure I'm going to get many messages being like, I want to see her as my doctor. Where did you say you're based again? Are you in Chicago?
Chicago.
Okay.
Yeah.
Okay. If you're in Chicago, but I mean, and we'll talk a little bit more at the end about like what specifically you offer in case people, if you're taking new patients perhaps, or can make other referrals. I want to talk right now a little bit about, so I think I might've shared with you on air. It might've been beforehand, but I sometimes have people say things to me like, I don't really know where I'm at with my fertility. I don't even know if I can have kids. Like, I'm not sure if it's possible for me. And specifically if people maybe have other underlying conditions. I've heard that the only way to definitively know if you can have kids is to become pregnant. And are there other things that people can do to like get their fertility tested? And if so, what should they be asking for? Because again, I've like read and heard different things where some of these different measures of like hormones or egg reserves, to your point about quality versus quantity, that those aren't necessarily helpful. So what would you say somebody who has that question mark about where they're at presently, what should they do or what should they be asking their doctor for?
Yep. Number one, having a conversation, particularly with somebody who has expertise in fertility care. Like not all OBGYNs do, they don't, they've got other things to do. They're amazing surgeons, right? So just like do a little, as you said, like a vibe check. Hey, is this like something that you're comfortable talking about? If not, can you help me find somebody who will? Like that's number one. Number two, your provider should be getting a really good medical history from you to kind of ascertain like, oh, you don't get a period very frequently. We got to dig into that. That could be a problem for you getting pregnant if that's something that you want, if you identify as female, have ovaries, et cetera. Or you have a history of endometriosis, or, you've got this pelvic pain that nobody's addressed. Like what's going on with that, right? Like, so there are probably certainly underlying things in history that you got to know about first that can influence your ability to conceive and have a safe and healthy pregnancy. So most providers should be getting that, like a detailed history. And then, as you mentioned earlier, there is no way to guarantee fertility. And I do emphasize that to my patients. Like we can check things, but it's really going to be a snapshot. It can't be like a guarantee, but some things that could be done, I'm not specifically advocating for them, yes or no. We can look at ovarian reserve, and I'm going to talk about why that's important. In a minute. We can check if the uterus looks generally normal, if there's any big cysts or fibroids or things growing. You can even check the uterine cavity, make sure there's something in the cavity that's for embryo implants. You can check the fallopian tubes and see if they're open. And that's not necessarily a bad thing to do as long as you understand it's a snapshot, right? Like things might look good now, your cavity looks good now, but if you wait 7 years, you might have a fibroid that's in the cavity. That's a growth of the muscle of the uterus. And if it's in the cavity, the embryo can't implant. So I might have told you today, things look good. That doesn't mean it's always going to be that way. So I think that that's something I always want to make sure people understand before they do some check. When it comes to ovarian reserve assessments, like checking how many eggs you have, you nailed it. Like it's not a measure of quality, but like I think where it becomes helpful is like, let's say you're 30 and you have a low ovarian reserve, like lower than we might expect. It doesn't mean that there's like a medical problem, but like, let's say, every month maybe you have like about 4 eggs that have the potential to be ovulated. Well, what we know is because egg quantity goes down, if you're somebody who's like, it's important for me to have kids and I don't want kids until I'm 42, just putting that out there.
Yeah.
Well, my concern would be, well, at that point, I can tell you, you're probably going to have 1 or 2 eggs that we might be able to get per cycle. You would likely need a fertility treatment, not guaranteed, but if you did, and if you needed a fertility treatment, you're not going to do great at 42 with like 2 eggs. So you're somebody who might want to freeze your eggs or like try to address it. But like, let's say you're 30 and your ovarian reserve is very high. Like you've got like 20, 30 eggs per month all ready to go. Doesn't mean that you're fertile. You can have so many problems. But again, I would, it's like, okay, well, what's your plan? When, do you want to be a parent? If so, when? What's realistic? And are you going to be facing fertility at a time when it's harder to get pregnant? That's like, so, and so that's really more where like ovarian reserve markers come in my book.
Okay. All right. That makes sense. I might just be throwing out random letters, but I feel like I've heard people talk about something like, is it AMH? Is that, and that's something they can get checked? And I feel like there's even tests you can like get online. Is that something people should look at or not? Is that sort of just what the internet tells us to do?
No, the internet is right sometimes. So AMH is anti-Müllerian hormone, and it's a hormone that's made by the cells that kind of support eggs, and it's proportional to how many eggs you have left. But it doesn't tell you exactly how many eggs you have left. In reality, the best way to use that information is like, how well would you do with ovarian stimulation for either egg freezing or IVF if you needed it. So a high number means you're going to respond pretty well. A low number means you may not get that many eggs. But I can't look at that number and say, oh, Keltie, you've got, 20,000 eggs left. There's no way to do that. It's ultimately, again, it's all like it's a snapshot in time. And the other thing about AMH that's important is, some people want to like kind of get it repeatedly, but there's good data that like it's not that helpful to trend it. Like if it's super, super low and you're in your early 20s, there might be an underlying issue and you might experience, menopause sooner than other people. But for the rest of folks, especially as you get into your 30s, like tracking it isn't particularly helpful in terms of like planning, like, oh, okay, am I going to go through menopause at 47 or, 49 or 54? Like it doesn't work quite that well.
So I know firsthand that when you are struggling with this decision of whether or not to have kids, that it can feel so lonely and alienating, that you are truly the only person asking questions like, what if I regret my decision? Or would I even like being a parent? Or what if I don't have kids and I'm lonely when I'm old? But if there's one thing I hope you've learned from this podcast, all of our conversations, is that you are most certainly not alone in this decision. And I tend to see the same sorts of concerns and fears and sort of decision sticking points coming up time and time again. And that is why I've created the Kids or Childfree Support Series. Now, if you are not familiar with the support series, we kicked off the last series in January, and we are starting a new one this month in July. And I'm going to tell you all about what it entails. So these are standalone sessions that happen each month. They're a couple of hours long, and we tackle a very specific aspect of the kids or child-free choice. This is something different than my group program and even my one-on-one coaching, in the sense that rather than taking a broad view and really looking at how can we solve and resolve and answer this question, kids or child-free, we are going deep on one particular aspect of this decision. Whether it's maybe you are at odds with your partner on this decision, or perhaps you have a fear of missing out about what path you don't choose, we're going to be talking just about this one aspect of this choice in these monthly sessions. And how they work is you can either join us for a single standalone session, or 2 or 3 or 4, or you can get a pass for all 6 months of the series. And when you get an all access pass, you will be incentivized to do so. The ticket price works out to $30, so 6 sessions for $180, or you can purchase each individual session, or as many as you'd like, for $45 each. Now, over and above these sessions, I also create a Slack channel where we have an online community together for the duration of the series. And whether you attend 1, 3, or all 6 sessions, you will get access to that. And that's another place for conversation and where I share resources. But let me tell you, the real good stuff happens in these sessions where we're going to be workshopping and talking about the specific aspects of this decision that have got you stuck. I'm going to be sharing different prompts. We're going to be having discussion. You're going to get some notes or questions that you can reflect upon after the session. I would love to have you join us for one or more of these upcoming sessions. Again, your best bet is to get the all access pass for $180. So this is on sale now. Check it out at kidsorchildfree.com under the Work With Me tab. I will also link to the support series page in the show notes of today's episode. Okay, I just feel like, again, so much of what we're seeing and hearing, the implication to me is that there's all these things out there that can give you this clear picture without even having spoken to your doctor, and maybe overstating things. But what I'm hearing is no, you should be speaking with a physician who specializes in fertility, who can be consultative, ask you those questions, get the full medical history, get that snapshot, as you say, maybe literally through certain imaging. But the only way to know for sure is by going through that process of trying to conceive through whichever various means, which, I mean, we're going to talk about things like fertility preservation in a second, and as well as IVF. But before I do, I just want to talk about, for those people who have a male partner, I feel like the onus is so often put on women. And the idea is okay, our fertility is declining and it's our eggs. And I was really surprised. I referenced Leslie Schrock in her book, Fertility Rules, that and correct me if I've got the stat wrong, but something like 50% of infertility cases can be attributable to a male partner. Is that correct? And if so, should our partners be thinking about this, or can men just have babies forever, a la, I don't know, Al Pacino or Robert De Niro, or these guys who are having babies in their 70s and 80s?
Oh my gosh, I'm so glad you brought that up. I was about to kind of chime in with something about that, because we've been talking about people with ovaries.
Yeah.
But, so yeah, generally that's about right. So about 25% of the time when people have fertility issues, it's what we call a male factor issue, poor quantity, very poor motility. So it makes it the sperm harder to swim up where they're supposed to go. So 25% of the time, the sole issue is going to be a male issue or a sperm issue. About another 20% of the time, it kind of depends on what data set you're using. There can be both a male and a female issue together. So adding it up around, I'd say usually 45% of the time, there's a male issue that's contributing to fertility issues. So that's about in line with what Leslie said. So, yeah. And in terms of male or, testicular aging, there are changes as men get older, but they don't impact fertility the same way. What can happen is, so men, when they go through puberty, or people with testes, when they go through puberty, they make sperm for the rest of their lives. They make 1,000 sperm a second. It's wild. Whereas, right, people with ovaries, you're born with all the eggs you have, and that's it. Good luck, right? For men, they're making new sperm all the time. The machinery to do that is pretty good in 20s, 30s, etc. Around age 40, the machinery does start to break down in terms of copying the DNA. So although the quantity of sperm is still usually sufficient to get somebody pregnant, the quality starts to go down a little bit. What we know is that over age 40, men, their sperm, the DNA in the sperm tend to get more microdeletions or duplication. So they're not missing whole chromosomes, but the DNA quality might not be as good. And so that increases the risk for neuropsychiatric or neurodevelopmental issues like autism, or psychiatric issues like schizophrenia do tend to go up as the male partner, the person contributing the sperm, gets older, particularly over the age of 40. Yeah. It's also true that globally we're seeing that kind of sperm quality goes down as you age. But again, this is where the media gets all up in arms to get you to click. Usually most men, even as they get older, still make enough sperm, millions per ejaculate, that they can get someone pregnant. So to your point, Al Pacino can still get somebody pregnant, and he's not a medical miracle. Most people just choose not to continue to reproduce.
Indefinitely.
And they're in their 8th decade of life. But, they're able to produce, whereas people with ovaries typically would not.
Okay, I appreciate the clarification. Okay, let's talk a little bit about fertility preservation. I thought first we'd maybe look at things that we can do without doing something like an egg or embryo freezing, if there are things that we can do to preserve our fertility. Because again, I think there's probably lots of, buy these special supplements or click this button and your fertility will improve. And then I want to move to like additional options that might be suitable for someone who's still on the fence or like considering having kids.
Mm-hmm. So in terms of like non-medical ways to preserve your fertility, there really aren't things that we can do, unfortunately, that are not clinically available. I mean, there's some cool science happening around stem cells and like pushing stem cells to become eggs. And so, long term, maybe in the future, that's going to be a technique that's possible, but it's not clinically available right now. There was some interesting data out of Europe, might have been last year, maybe 2 years ago. I can't remember anymore. Looking at medications like rapamycin, which is like it's like a immune modulator that somehow, if you give it to people in their like 20s, it might maintain ovarian reserve a little bit better. But again, not clinically available, not game time ready. And I'm not clear that it would actually preserve egg quality, right? Because there are so many molecular things that are happening that we can't stop. So in my view, there's no magic pill to protect egg quantity or quality. And just to be super clear, even like birth control pills, like sometimes I've had patients think like, oh, well, I'm not ovulating because I'm using the birth control pill. Like, isn't that helping me like not, release an egg? Yeah, you're not releasing that mature egg, but you're still like losing eggs constantly. So right now, no, there's not really a medical thing to kind of preserve ovarian reserve or quality. That said, it's always important to have like a healthy lifestyle, not smoking. So smoking is associated with an accelerated loss of eggs. In general, I think that there's probably a theme of stress to the body can lead to at least damages to egg quality. I'm being very kind of coarse here and happy to nerd out on another talk about it. But, ultimately, things like heavy alcohol intake, being of a higher weight with like a lot of excess, what we would call like adipose or fat tissue, those things can stress out the body, probably damage egg and sperm quality, might I add, making your, chances maybe a little bit harder than other people in your age cohort. But so living a healthy lifestyle, which I kind of hate to say because it's so trite, but like, kind of common sense things are not going to be hurtful to you.
Yeah. Okay. All right. And what about, when do you recommend egg freezing? And then I understand that, if you're with the partner that you would anticipate having children with, that some doctors recommend embryo freezing. What's the benefit of one versus the other? And when would you suggest that somebody consider that if, they're thinking about maybe having kids?
I love your framing of suggesting that people consider, because that's what I do. I would not, I'm not going to be like, you need egg freezing and you need embryo freezing. Like I can't, okay, I can't, right? But, I think, again, like, let's say the goals align and this is somebody who maybe like they're 32, they don't want to have kids till they're 42, but they do want kids. They're not totally sure, but they're pretty sure. And the textbook answer is the sooner the better, because, when you're younger, your egg quality is better, your egg quantity is better. You would respond better to treatment. You'll get more eggs of a good quality. So that's kind of the textbook answer overall. There's a cool cost benefit analysis that they did maybe like almost 10 years ago now, looking at, when's the right time to freeze, usually by 35, 36, because the issue is if you're, let's say 42 and you're thinking about this, it's probably not that cost effective. It's thousands of dollars to freeze eggs or freeze embryos. You're not going to have that many and the quality is going to be poor. So it's not like a hard stop no. Again, it's always going to be like, it really should be personalized. Like, are you somebody with a high ovarian reserve? Are you somebody who's willing to do multiple cycles? Like, there's so many, decision points. So I don't want, your audience to take away like you can't freeze at 42, but it just becomes like less effective and more costly. And we really do start to see that transition in terms of like benefit around 35, 36, 37, depending on what study you look at. So certainly if you're thinking about it, doing it by that time is going to be helpful. And in terms of like egg versus embryo, I love talking about this. So there's some data, I think it's getting a little old and I'm hoping somebody's going to do an updated study, but so eggs are a single cell. Mm-hmm. And they're one of the largest cells in the body, if not the largest. And so they have a high water content. And so the problem with that is when you freeze an egg, typically water is the only molecule on Earth that expands when you freeze it, not, shrinks. Yeah. So when you freeze an egg, particularly with older techniques, you can really damage the structures that kind of keep DNA integrity, chromosomal integrity. And so when you go to thaw eggs, particularly in older, I'm old, I guess, in the literature, people over 35.
I'm really old.
we're getting there. Yeah. If you freeze and thaw eggs, especially over 35, they don't freeze and thaw quite as well. Again, problem is, I think some of the techniques used we don't use so much anymore. Yeah. So maybe we might be a little bit better off. But in general, we would say, like, if you're under 35, if you freeze and thaw eggs, they do almost as well as embryos. Embryos are multicellular structures, but literally the same, within essentially the same shell of the egg. So that means that the volume of water in a particular cell is much smaller. So they don't get the same stressors from freezing that an egg would. So in general, embryos have a freeze thaw rate of about 95%. So again, if you let's say 20 embryos, maybe one wouldn't survive the thaw. For eggs, if you're under 35, the freeze thaw rate, I'd say it's around 92, 93%, kind of depends on the study. So the majority, but out of 20 eggs, maybe 18 survive the thaw. If you're over 35, then maybe it's more like 15, 17 survive the thaw. So on the surface, you may be like, oh my gosh, I need to make embryos. But choosing the male genetic parentage of your potential offspring is such a big deal. I would rather folks feel like maybe they need to do a second cycle and freeze more eggs to compensate than to fertilize those eggs just to, preserve their thaw ability. To me, I feel like that's not a great choice, but I don't say that. I give them all of the data and let them decide what they want to do with it. But embryo freezing can be helpful because, you get eggs. All we know is that you've got mature eggs. We don't know if they're going to fertilize. There's always a risk if they don't fertilize. And if they don't, you're done. Those eggs don't work, right? And if they fertilize, are they going to grow? Most early embryos of most fertilized eggs that we grow in culture will make it to about day 3 of embryo existence, but only half make it to day 5
of
or
embryos.
Beyond. So the mature embryo stage, and that's when the embryo is more successful in implanting and leading to a live birth. So it's always possible that the embryos that you generate from your eggs don't lead to embryos. And again, you're done. Or those embryos are not chromosomally normal. If you get a mature embryo, you can actually biopsy it and see if it's chromosomally normal, because those are the embryos that have the best chance of leading to a live birth. So when you generate embryos, you're going to just get more information about the probability that cycle would lead to a successful pregnancy. And I think there's so many ways to build a family and be in relationships. So I'm not some guard, are you married or not? I don't care. Yeah. But it's more this is why I phrase it the same way. Is this somebody that you want to co-parent with, right? Mm. If you're confident, yep, we're going to be doing this together. I'm very confident in 5 years we're going to be together. Then probably it makes sense to, fertilize them, make embryos. But if you're well, we're likely going to get engaged, or maybe you're married. This happens. Maybe you're married and you actually are I might want to get out of this relationship, right? I'm not a relationship counselor, but I'm okay, you could freeze some eggs, make some embryos. It's up to you. What do you want to do? But there can be lots of situations in which you might freeze eggs, even though you have a partner. So it just depends on your situation.
So I'm curious your take on this. I just hearing a few different stories from people, I sometimes feel this idea of, if you're not sure if you want kids, just freeze your eggs, that it sometimes might give someone a sense of, I don't want to say false hope, but it might feel like an insurance policy that you may not actually be able to cash in, redeem, whatever one does with an insurance policy, use. What do people need to know about if they freeze their eggs? Like, I understand there must be a lot of variables, but is there a high likelihood that they then would be able to use those eggs? Or can you just tell us a little bit about that? Does it mean for sure, like if I freeze my eggs and I want to have kids in 5 years, then I can have kids, or not necessarily?
Not necessarily. It is it's very specific to the person, right?
Yeah.
Like, again, like if you're, let's say 40 freezing your eggs, only 40% of the eggs are, we think going to be chromosomally normal. Well, what if we only get 5 eggs, and what's 40% of 5? Is that 1 egg? Is that 2 eggs? Is that in that particular grab of eggs, 0 eggs? So having eggs in the bank can be helpful. But I think you have to be very clear about your likelihood of success with those eggs. And it varies particularly based on age and a little bit the technique in the lab, but I don't want to nerd out about that. But like if you go to like a reasonable fertility clinic with a reasonable IVF lab, and there's actually you can go to SART, the Society of Assisted Reproductive Technology, and you can kind of look at their numbers. Largely the techniques are the same. Maybe just don't go to like the one with like the absolute lowest pregnancy rates, in your city or something. But in general, it's going to be personalized based on your age and your egg quantity and your goals and all of that. But the other thing to keep in mind, and again, so I'm not a hard sell on egg freezing. It's like, I think it can be so amazing and such a way to advocate for yourself and empower yourself. If you're somebody who really wants to be a parent, I think it'd be such a great thing. However, it's not typically covered by insurance. It's thousands of dollars, and you have to pay to keep the eggs stored. And that's, somewhere between like $500 to $1,000 per year. And what I do tell patients is to me, the best scenario, if you're going to freeze your eggs, is you're somebody who ultimately comes back, you're infertile, you need IVF, and you've got good quality eggs that are going to give you a good success rate to get you a live birth. I think that the 2 bad scenarios to avoid are, number one, if you have eggs but they don't work, that's a total waste, right? Or if you have eggs and you never use them, then what was the point? You went under anesthesia, you had a surgical procedure, you spent thousands of dollars, and you don't use them. So if you're not likely to use them, I think that it's a little bit of a disservice. So again, that's why it always goes back to kind of the goals and everything. Like somebody who, let's say they're 32, they're in a relationship, they're with the person they want to be with, and they want to start having a family next year. It makes 0 sense to freeze eggs. You're not going to use those eggs, right? Unless you tell me you want 5 kids, then you might use those eggs. But for most people, that's probably
most people aren't having
case.
5 kids these days. I don't think. Trying to convince themselves 1, I can manage 1, maybe 2.
Right.
Okay. I mean, there's so much more we can talk about on this subject. I guess I want to ask you, is there anything in particular you'd like to specifically speak to that we haven't addressed? Because I could ask you questions for days.
Yeah, I guess there's maybe 2 or 3. I'll try to keep it brief. But one of them is, I think, and this is something I think that you're so great, and what you're doing is really needed in terms of kind of coaching and walking people through the process. And I think taking the time to think critically about who you are as a person, and what matters to you. Because, and I say this because, I, as a kid, thought, oh yeah, maybe I'll have kids someday. I didn't really care, but I was this is what people do. I'll have kids someday. And then I got to my 20s, and especially since I was passionate about obstetrics and gynecology, and I was exposing myself to kind of all of the woes of what it means to, be pregnant and have a family. I was not sure. I was in a long-term relationship, and then I broke up with my long-term boyfriend, and I was I do not want kids. I would like to avoid this, right?
How old were you then, out of curiosity, when you were nope, not happening?
24. And I was pretty solid with that. And even when I met my husband, we're they don't sound great. Doesn't seem like something I really need, right? And then I got to my early mid 30s. And what happened was I went to one of my good friends from work through this amazing party. And I had the time of my life. It was best party I've ever been to, with all the people that I really enjoyed. I was doing the work that I wanted to do and helping people build families. And for me, I was also the party went late. It was like 2 a.m. And I was like, this is great, but I'm tired. I'm like, is this what I'm going to do the rest of my life? So for me personally, I was like, I think I'm looking for another way to bring meaning into my life, but I'm using so much of like, me just to say, this is not what everybody's going to go through. Some people are going to be like, meaning for me comes from, the work that I do, or meaning for me comes from being out in nature, or but I think giving yourself permission to pivot. So it was like, I had that party and then woke up the next day, I was like, oh man, like maybe should I have kids? Right. Yeah. And so it's okay. It's like, you can live your life saying like, no, 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 and then pivot. And like, I think if you just recognize, are you the kind of person that pivots in life? Are you okay with that? Or you're not?
Yeah.
And if you are the kind of person that pivots and you don't want kids now, then taking this biologic information about ovarian aging is really important. Take it seriously if you're somebody with ovaries. But if you're the kind of person who's like, no, I want to be an auntie my whole life, I don't like kids. I've seen, like, if you know yourself and know that you're not going to switch, cool. I just worry sometimes about the folks that like feel like my identity, as I said, I'm not going to have kids. And then they come back to me at like 44 and like, actually, maybe I do. Because it's just much harder for me to be able to help,
Absolutely. I'm so glad you spoke to that. And I want people who are listening to, like, if you need to go back and rewind a couple minutes, do listen again, because I think there's this, first of all, I know a lot of people who are on the fence are really afraid, like, well, what if, how do I trust that the way I'm feeling is right and that this is actually what I want or don't want? And I also know that and this happens on both sides, people who always planned on and thought they want to have kids, and suddenly they realize, well, maybe that's not for me. Maybe that's not the path I want to take, and vice versa. People who are vehemently like, no kids, and then start thinking like yourself, maybe that's something that's important. I think we often hold ourselves hostage to past choices that we've made, right? We feel like, as you say, that sort of becomes part of our identity. We don't want to go back on our word, even if it was just something that we've been telling ourselves. And I love what you share. And I think it's so important. I would invite everyone to really have like some grace and compassion, that if you're starting to notice a shift within yourself, one direction or another, tending more towards child-free or having kids, like, can you be curious about that rather than coming in with this sort of punitive, no, that's not allowed. That's not what you said. That wasn't the plan. That's not what you've told people, because we are allowed to change, and we do change. And I appreciate both your personal story of that, as well as the fact that, and I want to just clarify, this is something you sometimes see in your practice, is people who have been clear that they don't want kids or thought that they didn't, and now they're changing their mind. Can you speak to that a little bit?
Yeah, I see it more than I want to. And it sucks because like I'm here to help people, but like I can only do so much, with the tools that we currently have. And so I definitely get a lot of people that are like, oh, I wish somebody had told me about this earlier. I would have done it. And so it becomes like a mix of like poor information about ovarian aging and also maybe just not fully appreciating that your goals and wishes can change.
Yeah.
And it just makes me sad. I just wish I could help. So like, that was my one thought I had, just,
thank you for sharing it.
Yeah. And then the last one would be, there's a conversation right now around like, oh my gosh, fertility rates are declining so much. Like, what are we going to do? And there's, to some extent, some alarmist kind of conversation around, is there something like environmentally wrong? And there probably are some environmental factors that are not great that we need to avoid. True. Some of it is really that, women in particular are choosing to have families at a later age. It makes it harder to get pregnant. And then the third conversation that comes up sometimes is around really the economic impact of having kids, and that people are deciding like it's not great for them. I just think that there's like a fourth thing that I want to really throw out there in all of this, which is like, again, I keep saying it, like pregnancy is like the most dangerous time in a person's life. And, maternal mortality rates, particularly in the US, are way above other countries of a similar socioeconomic status. And, 1 in 4 to 1 in 3 women have been sexually assaulted in their life. And, 1 in 10, we think maybe men have been sexually assaulted. And I guess what I'm trying to say is, I guess the last part would be, hormonal contraceptives only really became a thing in the 60s. So for the majority of like human existence, like our contraceptive methods sucked and people got pregnant and people were having, 5, 7, 10 kids. But that probably doesn't reflect what women, half of the global population, actually wanted. And maybe what we're seeing is we're not setting up an environment to make this a good and safe way for people to build families. And I'm not saying if, you give people 5 years of parental leave and tons of money, they're going to do it, because some people just don't want kids, and that's great. Absolutely. And that's fine. But I just feel like it's missing in this conversation too. Like, yes, are there fertility issues? Yes. Is delaying fertility going to make it harder for you to get pregnant? Is that partially contributing? Sure. But being really honest about, like, we haven't made this a good and safe place for people to build families. I just had to say that because it's been really bugging me.
Yeah, no, it's so important. I'm glad you speak to that. And I think it's something that's greatly overlooked in the conversation. It's like, why aren't people having children? And to your point, I mean, I would say from where I stand, one thing that's missing is, guess what? Some people just don't want to, and they never really wanted to. And I mean, you've basically said that people had more kids than they wanted to. Yeah, as in some people didn't want any, but they still had kids. But I also agree that the way that we are societally and from like a government perspective and culturally supporting parents and people who carry babies in particular, it's abhorrent. And it's the conditions. I mean, we have a very international audience. I think a good chunk of them are in the US. And of course, some of these issues are challenges elsewhere. But I think globally, I know a lot of us are attuned to like, how can we create, and that should be the question, how can we create a better environment such that people both want to have kids, they feel supported in having that, right from the word go, from fertility care, reproductive care, et cetera. So yeah, thank you for that. Okay, so tell us how we can find you, your clinic, how people can check out Roon. Let us know all the things we need to know.
Yeah. So for Roon, it's great. You can just go to roon.com, Roon. And there's also an app, which is fantastic. I usually see it on my app, on my phone. So that's Roon. To find me, I am on Instagram. I'm not a big Instagram person, but I'm trying, but it's like Amanda.J.Adeleye_MD. That's a way to find me. And my clinic is CCRM Fertility of Chicago. So just CCRM Chicago, you should be able to find me. If you happen to be in the Midwest, happy to see you. But this has been fantastic. And as you can see, like, I love talking about this. And you're spot on. And I feel very happy that there are people that have a resource to kind of think through these very difficult conversations, you know?
Absolutely. Well, thank you so much for coming on. And as always, we will include all the links in the show notes of today's episode. So you can check out what Amanda's up to. You can check out Roon. You can check out her clinic. Lots of good stuff in today's episode. Thank you again for coming on. This was fantastic.
Thanks for having me.
All right, before I say a final farewell, I just want to let you know that I have a bunch of free resources over at kidsorchildfree.com that you can download to check out. We've got a Kids or Child Free book guide with a whole bunch of fiction and nonfiction books to help you navigate your kids or child free decision with different perspectives, different stories that are hopefully going to help you shed some light on whether to have kids or stay child free. We also have a response guide, which is perfect for those of you who are grappling with nosy questions, people asking you like, so when are you going to have kids? Or what do you mean you don't want kids? I've got different scripts you can follow in terms of how to answer those questions. I also even have a little secret podcast episode, a solo episode that I recorded after a difficult conversation with a friend, really about how this kids or child-free decision, this whole conversation of should I have kids or not, can be very emotional and triggering oftentimes. So if you want to check out those and a bunch of others free resources that I have, head over to kidsorchildfree.com. I will include the link in the show notes for today's episode, and you can start downloading some of those resources to check out to help you with your decision.